the most exciting part of our association with NextCore is the development of our business model, and obviously integral with the vision. We had an emergency department that was grossly undersized for the volumes that it was seeing. We had an imaging department that was it was in poor condition, and we had a competing imaging service right on the campus, so two adjacent to each other. Lots of problems. What NextCore was able to do was to get us to recognize that in the case of Holy Family Hospital, one of the real keys to admissions to the hospital and utilization of our ambulatory services was our emergency department and the imaging services. And so what they helped us develop was an extraordinary vision for those two services. To give you an example, our original business plan allowed for a new emergency department that might double in volume in 7 or 8 years. NextCore suggested it would double a lot sooner. In fact, it doubled in a little over 2 years to almost 80,000 visits a year from around 35, 36 was where we started. Extraordinary growth. They saw that the development of a really first-class, comprehensive, fully integrated emergency department would draw patients from wide and far, and it did. They also saw the vision of making sense out of what was not sense in our imaging issue. Hospital-based program competing with an on-campus separate program that was owned by the physicians. Let's bring them together. Let's put together a program like does not exist in the United States. And in fact, it is the most unique imaging program in the country, we believe. It is also, by some reckoning, the largest imaging center now in the state. With over 400 or 500, almost 500 patients a day are going through our imaging service. It is a joint venture with our physicians and has proved to be remarkably successful. I really don't think either one of those two programs would have come into being were it not for the strategic planning, the visioning services, and the consulting services that NextCore brought to the table. I think we would have had something much less workable, much smaller in size and scale, and much less suited to the needs of the patients that we serve. That was their major strength in our association with them, is to bring that really brilliant vision for those several services onto the table.